Hello everybody, my name is Carlos LaBoy. I did this project alone, and today I'm going to be talking about what it's like to be an operating room nurse. On the agenda, we have a day in the life of, what is an OR nurse, what does an OR nurse do, the pros and cons, and a summary. An operating room nurses play a vital role in the surgical team, contributing significantly to patient care before, during, and after surgical procedures. They are the coach of the football team, and the operating room is their field of play. They can scrub into surgeries, and for the most part, they guide the flow of the procedure, making sure everything is ready and done in a timely manner. An operating room nurse's day typically begins early, with shifts often starting around 6 a.m. Upon arriving at the hospital, nurses take a moment to prepare themselves for the responsibilities ahead. This includes changing into scrubs, reviewing their schedule for the day, and sipping on a cup of coffee to energize them. One of the first tasks is attending the preoperative briefing, a meeting where the surgical team discusses the day's procedures, reviews patients' charts, and confirms details about surgeries. During this meeting, the operating room nurses plays an essential role in ensuring that all necessary equipment and supplies are accounted for, and that everyone on the team is informed about their roles and responsibilities. Following the briefing, the nurse prepares the operating room for the scheduled surgeries. This involves ensuring the OR is sterile, meticulously arranging surgical instruments, and verifying that all necessary supplies, such as drapes, sutures, and medications, are readily available. The nurse must pay close attention to details, and any oversight could have serious implications for patient safety. As part of the preparation, the nurse also checks the functionality of surgical equipment, ensuring that everything is in working order. This includes operating tables, lights, and anesthesia machines. The operating room works closely with the surgical team to create an environment that facilitates a successful and safe surgery. Once the patient arrives in the operating room, the nurse assumes a pivotal role. They greet the patient, provide reassurance, and ensure the consent forms are in order. As the anesthesia team prepares the patient for sedation, the nurse and some of the team begin to follow scrub procedures where vigorous hand washing takes place. Once the team returns and the anesthesia team has sedated the patient, the nurse monitors vital signs and prepares to assist the surgeon unless there is a team of surgical technicians readily available. If there's a surgical team there already, there usually is one, then the nurse can do things like chart and oversee the procedure. During the surgery, the operating room nurse's responsibilities include maintaining sterility, anticipating the surgeon's needs, and handing instruments as directed. Effective communication within the surgical team is crucial, as the nurse must constantly assess the patient's condition and alert the team to any changes in vital signs. The OR nurse is also responsible for keeping accurate records, documenting essential information throughout the procedure. Once the surgery is completed, the nurse plays a vital role in transferring the patient to the PACU, aka the recovery room. They provide vital information to the recovery team, ensuring continuity of care. The operating room nurse must communicate any concerns that arose during the surgery and relay post-operative instructions. In the recovery room, the nurse monitors the patient's vital signs and overall condition, providing reassurance and support as the patient awakens from anesthesia. This phase is critical as patients may experience confusion or anxiety following surgery. The nurse's ability to offer comfort and clarity can significantly impact the patient's experience. A significant aspect of being an operating room nurse is collaboration. Nurses work closely with surgeons, anesthesiologists, surgical assistants, and other healthcare personnel to ensure that procedures run smoothly. Teamwork is essential not only for the success of the surgery, but also for creating a supportive environment for patients. Through effective communication, operating room nurses help foster a collaborative atmosphere. This teamwork enhances patient safety and contributes to a positive surgical experience. Some pros and cons to the career field. Working as an operating room nurse can be demanding. Nurses often face challenges such as high pressure situations, long hours, and emotional taxing cases. They must remain calm and focused even when unexpected complications arise. The ability to think critically and act swiftly is crucial in this dynamic environment. Working as an operating room nurse can be demanding, but at the same time, it can be a fun job. Despite the challenges, being an operating room nurse is also immensely rewarding. The opportunity to make a significant difference in patients' lives, witness their recovery, and work alongside a dedicated team creates a fulfilling career. The camaraderie among surgical staff and the satisfaction of contributing to the successful outcomes are motivating factors for many in this field. The salary can be rewarding as well, according to the U.S. Bureau of Labor and Statistics. They can average about $150,000 a year, and it can be more depending on if they're holding the on-call phone, if they work in long hours, which also depends on the staff. Some staffs are pretty short, so you can make a pretty lucrative career out of this job as well. Another thing that another pro to this career field is that you build some pretty cool friendships among the staff, because you're all going through the same thing as far as the job goes, and so you usually end up meeting some pretty cool people.